as a dentist, I thought that I was a very good dentist. I never did any mistakes until I put my cases in a big frame, and I start seeing all the frustration that I feel, and I still seeing all the mistakes that I see. Usually the pictures, when you put in the big frame, they're gonna start helping you, so you make sure you criticize yourself and make sure you're gonna improve yourself in the better way. So the pictures are going to help you and you growing, how you grow with your patients. Also the pictures, photography, and nowadays is very important to PSD cases. It's very important when you're going to choose these kind of patients, we can predict whatever is going to be our clinical part. Without even touching the patients, we can see how much we can cut the gums, how we can increase the bite, okay? So what's the color we can put the patients, what is the shape of the tool we can use in this patient. So that's a lot of useful tools that nowadays they give us the technologies. It's also important for the communication between our practitioner, our dental laboratory, and our patients. So make sure our patients are going to get whatever they're asking for, whatever they're looking for. So make sure the final result is what our patient needs. That's the more important thing, okay? Because it doesn't matter how much you spend in the lab, doesn't matter how much you spend in the clinical expertise. If the patient is not happy, something we are not doing right. And nowadays, marketing and branding, it's a little bit challenging, and we have to be up to date with all the new competency. So you can create new posters, you can take a good picture and post it in your social media, bring more patients, you can get more exposure. So you can do all by yourself, or whatever I create here is to make sure you or your dental assistants in your office are going to use these useful and settings and easy settings, so you can take all these pictures with just these kind of cameras and these equipments. That's it. Once again, I create just one edited protocol, unique settings, and one camera kit. With all of this, you're gonna be able to take all these kind of pictures. So we can take intraoral pictures, we can take a close-up, okay? So we can take artistic pictures. You also can take a headshots of the patient's face, extraoral pictures, and for fun, you can take polarization, so you can send all this job to your lab technicians. So what is the settings that I do? Okay, so first of all, the camera, they have f-stop or the aperture, okay? So when we're gonna do like pictures like this, portraits, okay? So we're always gonna choose between two f10 and f11. Why is that? Because we don't need so much depth, and we like to capture the whole frame of the picture. If you want to do portraits or sometimes these kind of pictures from the lab, okay? So what are we gonna use? You're gonna use f22 and f29, okay? Because we would like to capture more sharpness. We would like to capture the entire part, and it needs to be sharp. That's why we're gonna use always in that part.
That's cool.
In intro. So if you want to do close-ups, if you want to do anything, like you want to see your gums, if you want to see 1 to 2 teeth, I recommend you to use f14 to f18, okay?